So we are waiting for today's COVID update from the Department of Public Health. But as of yesterday's accounting here in LA County, 2,006 new cases, 49 new deaths, 1,433 current hospitalizations just in LA County. Henry Mayo Newhall pharmacist and clinical coordinator Dr. Courtney Mattley administered the first shot at the hospital back on January 8th. And she joins us live in studio. Dr. Mattley, thank you for coming in.
Hi, thank you for having me.
Of course, of course. So 8 months and 1 day out from V-Day, the moment we were all excited for. Are we further along or behind schedule from where you thought we'd be?
We're behind schedule, to be honest. I mean, we started pretty great, and then it's definitely leveled off. And I think with the surge of Delta, we're seeing some vaccination rates pick up again. But as far as the expectation and comparing it to some of the European countries, we're definitely behind. We're not quite at that 80% vaccination rate that we're hoping to get to.
I saw a poll at the end of last month, and I'll say it right here. It's the only country with more anti-vaccine residents than the United States. The only country with more is Russia. Is there frustration among healthcare workers, maybe some at Henry Mayo Newhall, regarding misinformation or conspiracy theories that you guys are seeing?
Yeah, there's definitely misinformation. That's probably one of the most concerning things right now is the fact that so much misinformation is out there. And I don't always blame people for it because it's so available, the misinformation. And if they go searching for data and they want to do the right thing, they want to look and see what the safety data is, you're going to come across misinformation. So it does put a damper on the process, definitely.
Mm-hmm. Is there any group of people outside of people 12 years of age and younger, pregnant women, breastfeeding moms, immunocompromised? Is there anybody who should avoid or hold off on taking the vaccine?
No, actually. So immunocompromised, pregnancy is a form of being immunocompromised, actually. So immunocompromised is one of the main reasons to get vaccinated, actually, and pregnancy. Pregnancy, it's recommended by ACOG, the American College of Obstetrics. It is recommended for pregnant women to get it. So 12 and older, the data is there, and it looks really great. And the only contraindication to not get it is if somebody had an anaphylactic reaction to the very first dose, or if they're allergic to some sort of component in the vaccine. But otherwise, anyone would qualify.
I saw a story of an ESPN reporter actually today who stepped away from the company after choosing not to get vaccinated. She's trying for a child, and that was her reason for stepping away from the company. Is there any data that would suggest that infertility is a side effect or resulting from the vaccine?
Biggest question I get from women is will I be able to have kids? Definitely, that's one of the biggest questions.
I have a cousin, a guy who, for the same reason.
Yeah. So we have a system called the Vaccine Adverse Event Reporting System, right? So we do have a system to report anything that might possibly happen after somebody gets a vaccine, which is great. It's open to the public, the physicians, myself, anyone can enter any data. So if somebody does have a miscarriage or does have issues with fertility after getting the vaccine, there is a way to input that data. And that system called VAERS has so much information. There's stuff in there that's reported between, death, myocarditis, blood clot, everything gets reported in there. And what our job is as the science community is to decide what is noise and then what is actual signal, right? So there might be stuff in there that says, hey, I had a miscarriage after the vaccine, so it must be correlated. It must be the cause, right? So the job of the scientist is to look at the data and see, is there a signal for concern? Or does the data match the exact same baseline data as before the vaccine, which is what they're seeing. So some of these reports that leads to misinformation has the same type of data as before the vaccine even started. And the VAERS system, it definitely works. This is how we picked up with Johnson & Johnson the risk of blood clots. So it's 1 in a million. We would have never picked that up if the VAERS system wasn't working, right? So it does work, but we also have to get some of the noise out of there and compare it to the baseline data.
She is Dr. Courtney Mattley, Henry Mayo Newhall pharmacist and clinical coordinator. She also administered the first shot at the hospital back in January of this year. How was that?
Oh, it was such an honor. Yeah, it was to one of our most fabulous ICU nurses who's been treating COVID patients from the beginning. So it was an honor to give her the first shot.
I had an emotional reaction. I didn't have an adverse reaction. I honestly teared up after I got my first shot because I thought we were getting out of this.
It was a crossroads for sure.
Yeah, 6 months later, we are still in this. So COVID-19 is a preventable disease. Biggest tool to prevent the spread is the COVID-19 vaccine. You can get some more info. Reach out to a doctor. Schedule your visit today at henrymayo.com. That is henrymayo.com. What is the wildest conspiracy theory you've heard?
There's a lot of wild ones out there. One of the ones that concerns me, actually, that is spreading is the concern that the vaccine can actually make the disease worse. So there's this theory that if you get the vaccine, you're actually more at risk of severe disease or more at risk of dying if you were to end up getting COVID, which would mean that it's doing the opposite of what we want, right?
Yeah.
And I think asking that question is a valid question because there is precedence for it. There were vaccines developed, in the 60s. Dengue, the first attempt of getting an RSV vaccine, it did do something called antibody enhancement response, in which the antibodies actually were not neutralizing antibodies. They actually were non-neutralizing antibodies, and there was potential for severe disease even with the vaccine, potentially worse. Mm-hmm. But that means it's on our radar. That means it's being tested. It was tested well before it was even administered to the first person. So it was something that was researched well. And it's also something we're not seeing. So we have so much real-world experience now with the vaccine. And if this was true, if we really were giving vaccines and that was making the disease worse, then what would be happening in our ICUs? It'd be full of vaccinated people. But that's just not what we're seeing. Everybody almost everybody, 90th percentile, staggering numbers of difference between vaccinated and unvaccinated in the ICU and people dying.
Yeah. And, that is one of the biggest pushes for people to get the vaccine. Not that it's going to prevent the disease overall, but it'll keep you out of the hospitals and it'll keep you from taxing the healthcare workers and the healthcare system who have been under fire for 18 months now.
Yeah. Getting the vaccine means if you do get COVID, you're probably just going to get something like the common cold or less.
Right.
So if that's not proof in itself that the vaccine works, then I don't know what is. The fact that everybody in the ICU today is pretty much all unvaccinated people, to me, is the best evidence we have.
So if it's not vaccine mandates and it's not the FDA approval, what do you think is going to get people off the sidelines and to stop playing the wait and see game? Because as we've seen, hundreds of millions of people have gotten the vaccine, largely safe and effective for the most part.
Yeah.
What do you think is going to get people off the sidelines?
I think politics plays a huge part of it, and I'm not sure if the mandate's going to help or not. There's a lot of emotions around the mandate, and some people just are already rejecting the idea of getting vaccinated because there's a mandate and they want it to be their choice, which I understand. But I think asking the questions is the first step, right? Like if you ask the question, that's great. And I fully support asking the questions. This is your life. This is your health, your family's health. Ask the questions, but also be open to hear the answers. So you can ask as many questions as you want, but if the answers are, if your ears are shut to the answers, then what's the point of asking the questions?
Right. If you have your mind made up already. And finally, by the way, we're talking to Henry Mayo Newhall pharmacist and clinical coordinator, Courtney Mattley. She is joining us here in the studio. As far as booster shots go, we are now 8 months past the first dose being given out. What is the state of that? Do you believe that only the most vulnerable people, 65 and up, and immunocompromised people should be receiving this booster shot? Or do you think everybody should?
So the data is still yet to be determined. What we do know is that immunocompromised people probably will need an additional dose, a third dose. And it's actually considered a third dose more than a booster because the immunocompromised who got their first 2 doses while they were immunocompromised probably didn't mount the immune response that someone like you or me or someone who's not immunocompromised would have responded to. So the goal is to give them a third dose, which is pretty common with other vaccines as well, to give a third dose in order to get that last push to fully get them vaccinated. So for sure, I think immunocompromised is a definite. They're going to need a third dose. The rest of the population is to be determined, and the FDA is reviewing the data now. I think September 17th is when they're officially making a recommendation. But probably elderly just because they don't mount an immune response like the younger population. They may need a booster, which is normal even for flu. Like for flu vaccines, we give a higher dose to the elderly to make sure that they mount an appropriate immune response. So this is nothing new or nothing to be concerned of.
She's Dr. Courtney Mattley, pharmacist, clinical coordinator at Henry Mayo Newhall Hospital. Thank you so much for coming in. And of course, as I said, COVID-19, preventable disease, the biggest tool we have are masks and vaccines. So get the information you want. Maybe you don't want it. Maybe it's the information you need. Get the information, resources, reach out to a doctor, find out everything that they got going on at Henry Mayo. Schedule your visit today at henrymayo.com. Thank you so much, Dr. Mattley.
Thank you for having me.
Of course.